So it looks like I have a patient arriving for a very detailed medical exam. Okay, perfect. This is for an annual checkup. Great, let's have the nurse send them into the room. And let's make sure that I have everything set up. I do. Perfect. And hello there, welcome to Dream City Clinic. Are you here for the very detailed medical exam? You are? Perfect timing. If you could, just get yourself all cozy and comfortable and take a seat at that medical table right in front of you. And who is that next to you? You brought a parent to a very detailed medical exam. Are you comfortable with that? Yeah, because there's going to be moments where I'm going to ask you some very detailed personal questions that might be a bit uncomfortable with a parent around. You're fine for now? Okay, well, we can let them leave the room later. Parent, take a seat over there and don't say a word. Are you comfortable sitting up there? Good, 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 good. So, I know I'm not your primary physician, but I am Dr. TMI, and I am filling in the position for today. What does TMI stand for? Too much information. You'll find out why. Good. So, what I'm going to do here is today we're going to be asking you a ton of personal questions, extremely personal questions, okay? And if you don't feel comfortable with an exam or a question, don't answer. I don't need to know. Okay? Good, 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 good. So, first off, can I get your name? Good. And how do you spell that? Beautiful name, honestly. And birthday? Okay. And you're that old? Your normal doctor is a pediatrician, and you're still seeing a pediatrician at your age. Okay, well, you might want to consider finding another doctor sometime soon. Just a heads up, okay? And I do see that we got your weight and your height. I did see that your weight and your height fluctuated a little bit between the last time that we saw you, which was 4 years ago. No judgment here, but full judgment. You have to go more often, okay? And do you want to talk about your height or your weight at all? You're good for now? You're good for now? Okay. I'll take that as yay, you're okay for now. So I'm going to begin the exam by getting some gloves, okay? And I always have to ask, how are you doing? Yeah, you seem a bit tired and uncomfortable. That's okay. Are you okay right now? Okay. Just asking. I have to ask. How has work or school been for you? Are you doing really well? Do you feel like you're succeeding? Okay, you know, sometimes it's okay to not succeed as well as others. Trust me, I have been there before, so it's okay. Are your grades doing well? Or are you doing really well in work? You don't want to say that in front of a parent? Okay, well, parent, it's time for you to leave the room already. Bye-bye. I'll see you in the waiting room. Have fun reading the old magazines. Good. So, now we're here. Free space. How are you doing? Thank you. That's all I wanted to know. Just the truth. I got you. Okay. So, what I'm going to do now is we're going to start performing the vitals exam. I'm going to be taking your vitals. And first I'm going to start with your temperature. I'm going to let you know all of these tools are freezing cold. Okay, they're super cold. And that's, I don't know what it is about a hospital, but they are so cold. And we're just going to take your temperature first, okay? Just sit still. Okay. And one more time. Perfect temperature, looking good. And what I'm going to do is write that down. And I'm going to get your heart rate, okay? And do you get nervous at the doctor's office? I did hear your stomach rumbling. Yeah, could that be the reason of like the flatulence? You don't want to say that. Okay, so we're going to get your heartbeat now. And again, this is freezing cold. I do apologize. There's nothing I can do. So I'm going to put this right here on your shoulder, next to your shoulder. Is that okay with you? Good. And just breathe in and breathe out and relax. Not the best. Let's go over here to this side. Okay. Your heart rate is very much so elevated. Are you very nervous? Or perhaps you were doing recreational activities before this, like running or sports or something else? Okay. Let's test your breathing on your lungs now. Breathe in and breathe out. And breathe in and breathe out. Lungs sound good. Let's test your stomach. I always put this right there on the thorax, the abdomen. Okay, and just relax, okay? Okay. So your stomach seems to be working in overdrive right now. Your heart rate is a bit elevated. Are you someone who perhaps eats a lot of food that's not too good for you? I do have to ask you. What are your favorite food types? Are you a fan of like really good potato chips? Are you a fan of like fast food? Yeah, well, that stuff is not good for you. I have to tell you that. But like, I know it's delicious, but it's not good for you, especially for like your stomach and especially for your bowels. Okay. And are you a fan of like what types of food places? McDonald's? Okay. Again, no judgment, but full judgment here. Okay, continue. Are you Taco Bell? Burger King? Okay, and what kind of like potato chips do you like? Oof. Flaming Hot Cheetos? Okay, that's like not good for your stomach. And again, if you do need to express yourself, perhaps cut some Parmesan cheese. You totally can. No embarrassment here. No one is going to judge you. Okay, and now what I'm going to do is I'm just going to feel your lymph nodes, okay? Just right there. I'm just going to feel your lymph nodes. And have you been sick in the past month or 2 weeks? Okay, and do you feel like you've been sick anytime recently within the year? No? Okay, just wondering. And then did that feel uncomfortable at all? You're good? Okay, I'm going to carefully cover one eye. And how many fingers am I holding up, if you can see? 5. What about now? 4. What about now? 3. Good. I'm gonna cover the other eye. Okay. How many fingers am I holding up now? 5. Okay. How about now? 1. And how about now? 2. Very good. Could you look at me? Okay. Can you look at the wall? Okay. Can you look at this wall? Can you look back at me? Can you look at this wall? And can you look at this wall? Okay. What I'm gonna do now is I'm gonna test your eyes. And I did notice by your eyes are a little bit irritated. Do you happen to have allergies, or were you drinking a lot of caffeinated beverages such as coffee or energy drinks? Okay, none of that really, or yes? Okay, so you do. Okay, and are you someone who as well doesn't go to bed quite early? Perhaps you go to bed really late at night? Yeah, I can tell. You seem like the type that goes to bed at 4 in the morning. Is that true? Am I true? Yeah. And do you use your cell phone often? Or like your computer all the time? Yeah, can you put your hand up for me? This is the easiest way to tell. Your pinky finger has an indent where you hold your phone all the time, and I can clearly tell that you've been scrolling on TikTok or YouTube because your pinky is indented. Yeah, I can tell. I can tell. So what I'm gonna do now is I'm just gonna check your eyes, okay? And looks like your pupils are doing good. They're a bit dilated more than usual. Did you do something perhaps where you were participating in some fun recreational activities before this? Some people like to, especially because sometimes they find the doctor's office or a clinic to not be the most friendliest. Thank you for letting me know. Okay, and by that I really mean like going outside, taking a nice long walk, or perhaps going outside and having a nice run. Gets the cardiovascular system working. Yeah, exactly. Okay, can you follow the light for me? I'm just gonna hold your head right there, okay? Good. And was that light too bright for you, or was it fine? Okay, I'm gonna ask you a couple of things now. This is called a visual test. Can you let me know what color is this object behind me right there? Or do you have any color deficiencies with your eyes? Okay, let's test. What color is this over here? That is blue, and what is it? It's a seahorse, good. And what color is this up here? It is yellow, and what is it? It's a moon, good. What color? Right there is my mug. I do have a coffee cup right there. What color is it? It is blue, very good. And can you let me know what that is behind me? What's on the poster? Yes, that is the skeletal system. Very good. And speaking of skeletal system, did you know your teeth are also bones? I did see you smiling there. Have you been flossing? Yeah, because I'm kind of sensing a dragon breath situation going on from you, which means that you could not be flossing as well as you could be. Have you ever heard of like halitosis, which is a buildup of bacteria? Can give you bad breath. I'm gonna write a quick prescription for a nice mouthwash for that. Okay, not trying to say anything about your bad breath, but not in 2022. We're gonna do something better about that, okay? Now what I'm gonna do is I'm gonna just feel your jaw right there. And can you bite down for me really carefully? Good, because I actually heard your jaw have a popping sound when you opened your mouth. Is that common? Do you get that often? Yeah, I can tell. And could you relax your jaw and clench it again and relax? Good, I got that. Thank you so much. Let's just write that down. Okay, now I'm going to take a look inside your ears and your nose. And do you listen to loud music? Because you seem like the type. And that's what I thought. That is what I thought. Okay, so I'm going to take a look inside your ears with an otoscope. And do you use Q-tips? I knew it. Okay, let's just see. Okay, you have a lot of wax buildup in your ears. Don't use Q-tips anymore, that doesn't work. I suggest hydrogen peroxide in your ear and letting it sit for a couple seconds and just using a towel to clean it, and I'm not even kidding you, all of that earwax gone. It's like amazing. Let's test your other ear, and this one is just as bad. Okay, and when you shower, just generally speaking, do you wash behind your ears? Because I can see that. You're gonna need to incorporate that into your life, okay? Now let's just see up your nose. This one's a bit uncomfortable, I do apologize. Okay, it looks good. And could you breathe in for me and breathe out? Good. Do you have any problems with your sinuses at all? Or do you feel like sometimes you can only breathe through one nostril? Okay, let me know because I could write that down. Okay, just writing that down. Good. Okay, now I'm just going to quickly test your ears. Okay. And I'm just going to do a quick hearing test. Let me know if you heard from your left to your right side, okay? Let's begin. Left to right, good. 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 Very good. Looks like your ears are working well. Okay. Now just a couple of questions before I proceed further with the exam, okay? I'm going to be asking you a couple of personal questions, okay? And you don't need to answer if you don't want to. You got it? Perfect. Do you have a group of friends in your life that you like? Yeah. And do you have a very good friend? Do you have someone in your life that you really like or you love? Good. And are these friendly friends very friendly with you? And do you know what I mean by friendly? Like they're kind to you, they treat you well. Good, I always like to know. Just because you deserve to have joy and happiness in your life. Good. And do you have a special friend or special friends? You know, where you participate in sharing life together. Good, okay. And with these special friends, do you have any special activities you do together? Yeah, like going on a picnic, going on a walk, or, you know, any of that. Any of that. Okay, you can let me know, no worries. Thank you. I always have to ask. It's just my thing, okay? And just to make sure that your health is good. Next, I'm going to be testing your reflexes. and this is a reflexology tool. I'm going to be testing it first on your forehead, and then I'm going to be testing it on your arms, okay? And then on your knees. So, first on your forehead. Good reflex, close your eyes. Good reflex, open your eyes. Good reflex, okay? Now I'm going to do testing right here. Keep your eyes open. Good reflex, very good. Now, I'm going to bring it close to your eye and just keep looking at it as much as you can, okay? Good. Very good. Perfect. Good reflexes, okay? Now follow the tool with your eye. Good. I'm going to move it more fast now. Keep looking at it. Great reflexes, good. Now I'm going to test your arms, okay? Give me one of your arms. And if you can, just relax them. Good, and give me your hand. Good reflex, other one. Good, another hand. Good. Okay, now I'm going to test your knees and try not to kick me or flagellate. It happened before, and just try not to, okay? Testing your knees. Good, and perfect. Thank you so much. Okay, reflexes are looking a-okay. Perfect. Okay. What I'm going to do now is I'm actually going to test your oxygen level with your finger. Okay, so I'm going to put this on your finger, okay? Just give me your hand. Good. And now let's wait 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And it looks like the oxygen level is perfect. Good. Okay. Now, I'm going to just be putting a little bit of pressure right here on your shoulders, and I want you to raise them. I want you to fight down, okay? I'm going to be testing your muscular system, so do not let me push down your shoulders, okay? Keep your elbows raised in 3, 2, 1. Resist, resist, resist. Good. Now, relax your arms and put your hands like this, and resist me pushing your elbows in, okay? 3, 2, 1. Resist, 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 resist. Good. You can relax your arms now. And the last one I do is a handshake test. I want you to squeeze my hand as hard as possible. It won't hurt me, but it should just test your muscular grip strength, okay? So shake my hand in 3, 2, 1. Okay, perfect. Let's test the other one. 3, 2, 1. Perfect. That's great. I'm going to write that down now. And I always have to ask you, there's going to be a couple of questions here that might be easy for you, but this is actually a cognitive test, okay? And I'm going to show you something on this card, and can you let me know what shape this is? Okay, can you recognize that? What shape is that? It might seem simple. It is a triangle or a cone. Very good. Okay, one more. Okay, what is this? There are 1, 2, 3, 4, 5, 6, 7, 8. There are 8 corners to the shape. What is this? This is a octagon. Very good. Okay. Now I'm going to ask you, can you recognize that color? What color is that? That is red. Good. And I'm going to ask you this. What color is this? This is blue. Very good. It might seem like a basic question to you, but some people I always test it with. Okay? And can you tell me the current month? What month is it right now? Good. Let me know. And can you tell me the last thing that you ate? McDonald's. We gotta change your diet. We gotta add more fiber in your diet, especially with your tummy acting like that. Okay. Now what I'm gonna do is I'm actually gonna put a little bit of pressure on your thorax, on your abdomen, okay? If that's okay with you. Good. And I'm just going to put a little bit of pressure here. And does that feel okay? Good. Okay. I do have to ask you this, okay? But when you do visit the restroom, okay, how many times per week are you able to go to the restroom and you are there and you have number 2. How many times a week? Okay. Okay, that is not nearly enough. I'm gonna write that down. I'm gonna be creating a separated new food recommendations list for you. Okay, and we're gonna be increasing the amount of fiber that you have by like so much. It's gonna be so good for your stomach, especially with the way that your stomach is making noises right now. I think it'd be really good to include that into your daily lifestyle. Yeah, very good. Okay, and just a couple of questions here before I do give you a reflex test with your eyes now. Do you wear glasses or contacts? Good. And do you feel like your vision has been the same since the last time you've been here, which was many years ago? Yeah, it would be different. So let's test that really quick. So we're going to be testing with your peripheral vision. And when one of my hand goes out of your peripheral vision, just let me know. Okay, so let's begin. Good. 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 Okay, let me know which hand is closer to you, my left or my right. Let's begin. Perfect. Good. 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 Perfect. Good. 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 Great. Perfect. Now a couple of finalizing questions here before I let you run off and have yourself a good rest of your evening. Okay? And are you a fan of recreational activities like sports or running, or perhaps you're into gymnastics, or perhaps you are into weightlifting? Are you involved with any of that? Okay, that's what I thought. I have to see the honest truth. You don't need to make something up, just be honest with me, okay? Do you think that you're getting 10,000 steps in a day? You need to be. It's good for your health, okay? And I'm gonna be a little bit annoying about that because it's good for you, okay? And you said you have many hours that you use on the phone or computer per day? Yeah, not good for you, not good for you. We need to limit that, okay? And speaking of working out and recreational activities, are you involved with other types of fun activities other than that? Like perhaps you go to the mall, or perhaps you have some really fun parties with your friends. Do you party often? Are you a party goer? And do you participate in party events? Okay, and how often is that? Okay, just asking you. Okay. And are you someone who's a fan of energy drinks and caffeine overload? We're gonna have to stop that. I typically stop people at drinking too much coffee or too much energy drinks of the day because it's just not good for your health, okay? So we're gonna have to put a limit on that. I'm gonna add some food recommendations into your lifestyle so you can have a lifestyle change. I'm gonna also recommend that mouthwash to you because I was very close to you. I'm also gonna send in some floss. And I'm going to send in a phone limiter for you so that we can spend more time on focusing on your health and not on the phone, okay? It's not good to compare yourself to other people. It's also not good to waste a lot of time online. Other than that, your health is A-okay, perfect, okay? So thank you so much for coming on in and letting me ask you all these questions. I'm going to be sending you a TMI detailed report of all of this, including regimented foods to increase fiber in your life. Okay. So increase in fiber so that your stomach doesn't come on in making Harry Potter spell sounds. Okay? Good. Just gonna write that in. Okay? Have yourself a good day. Again, I am Dr. TMI, Dr. Too Much Information. And thank you so much for just relaxing and having a good time here. Or I hope you did, okay? I'll be sending you all the paperwork through your health portal online. Good. Ciao for now. Bye.